Alors bonjour à tous.
Hello, everyone, and welcome to this press conference to have the overview of the Quebec situation about COVID-19. The Premier of Quebec, Mr. François Legault, together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health, Dr. Horacio Arruda. Mr. Premier. Yes, hello, everyone. Before going over the numbers for the day, I would like to have a short overview of what we've done in the past weeks and also a bit of what's coming up in the following weeks. First, what we've done in the past weeks. I think that a good result that we have, and we repeat it often, is that we freed up 6,000 beds in hospitals in order to be able to treat patients, people affected by the coronavirus who would need to be hospitalized. So we are ready to receive up to 6,000 people. We do not believe that we'll reach that number in what we call the peak or the summit. I would like to also remind you that we are one of the first states in North America, if not the first, to close down businesses that were non-essential. So that was a gesture that will probably pay off in the next few weeks. I would also like to remind you that when we compare ourselves to other states and countries in the world, we are amongst the places where we have done the most screening tests. So we have identified quite well the vectors of the virus. So it's normal that we have more vectors that are identified and confirmed. But what is very reassuring is to see that we don't have, when we look at it proportionally, of course, we don't have a lot of hospitalizations. And we have fewer deaths as well when we have a ratio per 1,000 inhabitants and we compare ourselves to elsewhere in the world. So those things are encouraging. Of course, I want to get back to the material, PPEs, personal protective equipment. Well, since the beginning of the crisis, particularly in the course of the past few weeks, we have an entire procurement team that has done everything in order to confirm the orders that we usually have and added to that. I think that we've done very good work on that end. And yesterday, a few orders did come in. And today, if we look at the different PPEs, right now we have enough for a week. So it's an improvement compared to yesterday. And we are continuing working very hard trying to confirm purchase orders, particularly in Asia, to supply cargo, to go get the merchandise. So we're working really very hard at this. We also have Quebec businesses, many of them, that are going to start supplying us with gowns and gloves and masks. So on that end, yes, there is perhaps a period that is more critical, that is to say, getting through the next week, but pretty quickly in the following weeks after that, we're going to start having Quebec companies that are going to be supplying material to us. So I am optimistic on that end. Now, talking about what's coming up, and I know that a lot of journalists, but also a lot of people would really like for us to reveal the scenarios that we have. Of course, what we are all trying to get as an answer is when are we going to get to that peak? Is it in 2 weeks? Is it in a month? Honestly, it is really difficult to be able to answer that question. I see courageous people in other jurisdictions, in other countries and states that are trying to give answers to that. And I understand that many people would like to have our scenarios. What I've asked people from public health is to work in the next few days at perhaps having a sort of most probable scenario so that people can think, okay, with the data, we're starting to have quite a bit of data. When do we think that this peak might arrive for the number of cases? So, of course, as Dr. Arruda often says, yes, we want to flatten the curve, but we're also very looking forward to being over that peak and being able to see a reduction in the the number of new cases and the number of hospitalizations, deaths, etc. So I just wanted to tell you, I am conscious of it. I've heard the message every evening. I read a lot the comments on social media. I understand that a lot of people would like to have that peak, that curve. They would like to have a better idea, and we will try to give it to you for a scenario which would be, the most probable according to us. But this will remain a probability. I don't think there's anybody in the world who can say with any kind of precision when that peak will be reached. Now, the overview of the past day, the numbers. We have 2 new deaths. We're now at 33. I offer my condolences to the families and loved ones of those 2 new victims. We now have 4,611 confirmed cases, an increase of 449. 307 people who are hospitalized. That is an increase only of 21. And we still have 82 people in intensive care. So no increase yesterday on the number of people in intensive care. That doesn't mean that some people didn't leave and some new people didn't come in, but net, we're still at 82, so that is very good news. I'm not saying that it's always going to be like that in the next few days. As I'm telling you, we are in probabilities and we are trying to predict as best as we can, but this is not an exact science. My greatest worry at the time concerns residences and homes for the elderly. Out of about 2,200 residences, we have 519 where there's at least 1 case. That is why a few days ago we announced a new budget of $133 million. Now we're going to get even stricter for people coming in and people coming out in each single residence. We're also offering the staff that can do so to go live at the hotel paid for by the government. Of course, I understand that not everybody can accept that. Some people have families, children that they have to take care of, but those that can do so, to go to the hotel in order to, of course, reduce the possibilities of having staff that will be infected and that will go work at the residence for the elderly. We should be able to, in the next few days, announce improvements of the wages for the attendants, including in the private sector. So the idea is also to say it's better to pay those people doing such extraordinary work in all the elderly and homes for the elderly. And I can understand that some people are worried because there are unfortunately already 519 of these centers where there's at least 1 case of an infected person. But I do want to get back to one point. As you can see, it is important, so important, to not visit. I know it's sad, but don't go visit the elderly in any residence. I'm not just talking about CHSLDs. Any home where there's a lot of elderly people living together. It's really important. It's a question of life or death. Do not take the risk of bringing the virus into these places. This morning, you saw that we sent a press release to add zones in the north to protect them. If you look at a map of Quebec, you will understand that there are regions that are very extended from the north to the south, and we have added the north of the Outaouais region, the Laurentians, Lanaudière, and Mauricie. You can see, Latsuc and those very northerly areas. Laurentians, Lanaudière, we're asking the people, first of all, who live in the north, to the north of those regions, to not come to the great urban centers in the south. When I look at the south, for example, of Lanaudière or the Laurentians, there's big cities there, and there's a lot of people who are moving about in between Montreal and the suburbs. So for sure, there's more people who are infected in the south of the regions, such as the Laurentians and Laval, So really, really important. People in the south don't go to the north, and the people in the north do not go down to the south. A word on the respect of guidelines. Although the very vast majority of Quebecers are respecting the guidelines, still I'm hearing from a lot of people that there are gatherings, meetings, for example, in parks, that there are non-essential businesses that are still open. So I'm asking you, once again, it is really important that the guidelines be respected. Once again, it's a question of life or death. My daily thanks are for the spouses, boyfriends, girlfriends of all those who are giving essential services, whether it be in the health network or grocery stores. I know that those people very often ensure a certain stability, a little bit of normality and bring comfort. So you have a very important role to play to be able to give strength and courage to those who continue working and who continue giving essential services. I would like to end with the same 3 priorities as before. Please, everyone, don't leave your home unless it is absolutely necessary. If you must leave the house, always make sure that you are at least 2 meters away from anybody else in order not to give or get the virus. And thirdly, when you come home, you wash your hands with soap for at least 20 seconds. So we've been saying since the beginning, we are here poised for the greatest battle of our collective lives, and we'll succeed if everybody, absolutely everybody, respects the guidelines. So I count on you. Thank you.
I want to say a few words about our preparation for the fight against the virus. First, we've freed 6,000 beds for the next few weeks. We are also one of the first place in North America to close non-essential businesses. We are also one of the places that test the most in the world. And we're working very hard to continue having medical supplies we need. So we're prepared for the fight, but we must continue our efforts. We must continue to protect our elderly population. There must be no visit in the residences. It's a question of life or death. This morning, we've also taken measures to limit traveling in the north of Quebec in regions, namely Outaouais, Laurentides, Laurentides, and Lanaudière, and Mauricie. And we must continue to follow our 3 priorities. Don't go out unless it's necessary. If you do go out, keep your distances. And when you come back home, wash your hands. That's how we'll save lives. Thank you all.
Merci, Monsieur le Premier ministre. Alors pour
Thank you, Mr. Premier. Question period now.
On va débuter aujourd'hui avec Hugo Pilon-Larose, La Presse.
Oui, bonjour, Monsieur Legault.
Hello, Mr. Legault. You are telling us that we have about, for a week, of a week's worth of PPE, so that's an improvement as of yesterday. But can you tell us, as of 1 week, what could be missing first? What could be run out of first? Well, for the time being, the 4 pieces of equipment that are important, the masks, the N95 ones, the surgical masks, what we call the procedural masks, the gowns, well, the gowns can be replaced by other kinds of fabric, and the gloves. So, pretty much equal. The surgical masks are perhaps the ones where we have the fewest stuff, but we're okay for about a week for those. For the screening tests, at this stage, could we perhaps be missing some chemical products, that would allow us to continue testing at the same rhythm? We're also following that, the swabs and the reactives to be able, or the reagents to be able to analyze. It's tight here as well. And Dr. Arruda will be able to say more about it. But we are changing a little bit the people that we want to test. We want to concentrate on the staff, the health staff, the people who are hospitalized, and we are changing. But we're very much ahead of time compared to what's been done elsewhere in the world. So we are starting to see, to have identified the places very much. And if you'll allow me to bring a few details, we had told you that we had established priorities for screening tests depending on the epidemiology that we had. We've put a lot of emphasis on traveling at the beginning because that is where the cases that we found were. Now we're going to have different priorities, as the Premier has said, for example, healthcare workers, etc., because we want to make sure that they're not infected and that they don't go infect other places. And we are adjusting those priorities depending on the epidemiology. I'll give you an example. Before, when there was a case that was a case of illness, there was a contact with the person who developed the symptoms. But before saying that it was a case, we tested that person because we were at the beginning. Now, if people are in the same family and they're close contact, what we call a contact with an epidemiological code, it becomes confirmed, not by lab, but epidemiologically speaking. So there's a whole series of cases right now that we won't need to test because it's okay, it's done continuously in all epidemics as such. So we adjust those priorities, and it is the public health directors who, depending on their territories and their epidemiology, it can be different, on the north coast from Montreal or from the eastern township. So now we have what we call a test prescription depending on the local epidemiology. So that is worked constantly. And with time as well, and we're not there yet, but with time, when we get maybe commercial tests where we can get the results in 24 hours, perhaps we'll even start, depending on where we are at the curve, to start testing people who have no symptoms, because then we'll want to see whether there's any potential outbreaks left. So it is completely normal that the treatment that we are giving, or the screening, or the exams that we are conducting will vary depending on the stage where we're at with the disease. So I think it is in that sense, if you'll allow me, if I compare it to medicine. If somebody has a very localized disease, we have an examination that is going to have that localized exam. If we believe that the person has a disease everywhere, we'll have AGs, other exams, CAT scans, etc. The same approach, but it changes the number of tests. You said earlier on that it was difficult to have predictions in terms of when we're going to reach the peak. In Ottawa, they're saying that it might be in July. That is to say that the curve could be extended up until July to protect the health network. Is that in your scenarios? Well, what Ottawa was talking about was the end of the curve. It was not the peak of the curve. It was the end of it. But once again, very difficult to predict. When will be the peak? When the curve is going to get closer to zero? There are many scenarios. Yes, we have scenarios that go all the way to July as far as the end of the curve is concerned. But as I was saying, we have many scenarios, and I ask public health in the next few days to try to come up with a scenario that might be more probable, although nothing will ever get confirmed. And if you'll allow me, Mr. Premier, I'd like to specify, we're having a meeting with our experts on that because we're studying it. And I would like to say one thing. The more time goes by, the more the estimate of our scenario will be good. At the beginning of things, and I don't know if you get it, and at the federal level, they can go forward, they can say it, that's fine. But the Canadian curve is going to depend on the curve of each of the provinces. Depending on our capacity to flatten down the curve, more or less, it will have an influence on that curve. I'm very happy to tell you that I don't know when the peak is going to come, because imagine if we had, and I'm going to go back to my image, a peak like this, where after 4 or 5 days we would have been in the peak, we would have been in a lot of trouble. So what we're doing is we're flattening it. We flatten it and we extend it. And it's when we have an inflection of the curve, when the acceleration of the curve starts going, oh, we're getting back. There's a point here where rather than keeping to go up, the progression decreases and we have a curve that does this. When we get to this stage, we'll look at it. Tonight we're meeting with our experts and I commit myself, and it's not a question of not wanting to tell you things. I commit myself to you that when we have an estimate that we find sufficiently precise to tell you it's going to be about here, we will tell you. And that will depend on the moment where we are seeing that inflection in the curve and that we can. And I don't want people to interpret this that because the curve is in inflection, that we are flattening it. No, because we don't want it to do this and then that. Because, you stop. It has to be this. You understood? Did you understand? That is why the more we wait and the more we know that our measures are continuing, and we have to reinforce them, and we can't stop. If at the time when we say that we are getting to the peak, people start not following the guidelines, you're going to put us all in trouble. We have to maintain even after the guidelines, because otherwise there could be things in the fall. So be assured that when we feel confident enough that the test that we have with the present data, not predictions, will tell us that it's about that time, we'll say it with all transparency, but I want to consult my experts. You added regions, and you said so. Avoid the north and south, except that in certain regions, it's random surveillance, so there won't be 24-hour a day. There's a lot of fear in the community. Is there not a risk if there's not somebody there for 24 hours, if there's not roadblocks all the time? Well, at some point it's a question of also respecting the guidelines. There are people that can walk on foot through the forest to go back up, but we try to have the police officers control main roads that go from north to south or south to north. But I'm also counting on the goodwill of Quebecers. Hello, Mr. Premier. After a few weeks in the management of this crisis, what are the lessons for what will come next? What should the government do differently to better control the pandemic? Well, I think that we are doing what had to be done. And I was able to appreciate a lot more time, as usual, with the people from the Ministry of Health, for example, and I am impressed by their work. And I believe that we just have to, as Dr. Arruda was saying, we can't stop. It's true in our messages, and it's true also in the follow-up with the guidelines, but we can't ease things. So we acted very early, and we didn't have too many people who were unhappy or, they didn't complain too much. If we keep proportion, we have more businesses that are closed, more construction sites that are closed, and people, despite this, are following, so we've done more than others. So I understand that some people are going to start, feeling tired, and maybe that is the challenge, is to make sure that everybody is resting. But I haven't seen that much discontent. And you announced today to support 10 million more to support community organizations. We've had echoes from a lot of people, the people who manage them. So that's 10 million for organizations that are already submerged, who are going to go into discretionary envelopes of MPs. So people are going to go with their judgment. MPs are going to go with their preference sometimes, whereas there's organizations like the CIS or municipalities that have a better knowledge of how these organizations work. So why not having chosen that way of doing it, the management of the monies for those needs? Well, for me, there are certain very important needs. There are certain that we serve with specific programs. Let's think about mental health, for example. We've been talking about it a lot. There are services that must be given in CLSCs. There are services that, Danielle has been discussing with the order psychologists to see whether certain services in mental health could not be rendered freely. But there are certain things, that we miss out on and that are picked up by community organizations. Another group that is important are the food banks. And I want to make sure that there is enough money and enough food in all food banks. I'm told that in certain regions sometimes there's a lot of branches of food banks, and sometimes the money doesn't quite trickle all the way down. And we have a special budget, and if it's necessary to put more money into food banks, we will. Now, there's also the discretionary amounts of the MPs, and I think that the 125 of all political parties, they know very well who their citizens are. And what I've been telling to the MPs is take care of your people. So if there's a program in mental health or food bank, or regardless where the network of health and social services, without any good, without meaning anything bad by it, dropped a ball somewhere, well, make sure that you help them out. So there's the budget that is given to MPs to add specifically. And I am very confident because I can see it with the MPs. They're very aware of what's going on. They know their organizations. They know their people. So yes, the CUs can do a part of the work, but in regrouping all the establishments within CIS and CIUS, those do become big organizations. So having somebody who's agile, like our 125 MPPs, to go and help where there are particular needs, I count a lot on them. And I'm talking about all four parties. They're all doing extraordinary work. And to make sure that if, there was somebody who is vulnerable in any way was somehow forgotten, that MPP will make sure to finance the organizations. And, this is something that takes place regularly in county offices as well. You have individuals who come to those offices. There's no programs, no organization. So then we call an organization. We tell the organization, here, give that person the service, and we will finance you for that with the money from the discretionary amount that MPPs have. So, of course, there's more needs than we usually have. That is why we're doubling that discretionary envelope. I have a question concerning public health in the eastern townships. We've seen that there's many cases. Most of the staff that has been sent to investigate the cases are either ill or isolated. Last weekend, an auditorium had to be disinfected where there had been an exchange of paper documents where they had gotten together. Anyway, they got infected. It seems that there's many days late to do the research of possible uncontrolled outbreaks. And since the Eastern Township is the second most affected region after Montreal, it's an important risk. What are you planning on doing? What has to be understood is that you have to be careful when you look at the rates only without having firm data. First of all, yes, the Eastern Townships, if we look at the rate compared to the population, it is high. But it is associated to what we call clusters. And that story of public health. We're not in a community transmission as we have in other regions such as in Montreal, as we'll observe in not too long in Laval. So the Director of Public Health, whom we contact every day, unfortunately, there are people who have been ill, and well, thank goodness they're doing relatively well. But they still have the ability to do investigation. It's possible that there's a slight delay, but all the actions that have to be set up when we signal a phenomenon, for example, there's a case in such and such a place, they will do the investigation. It's possible that it may take longer with the contacts. They tell them, to isolate them. But what we will do in the Eastern Townships, as everywhere else, will continue. And this is the case in Montreal as well. Even the hot zones in Montreal, we investigate every single case, the contacts, take local measures to avoid the spread. Right now, the Eastern Townships are controlling their hot zones, their clusters. If it changes, if it goes to community, well, they might go to confinement or controls as have been made others. But right now, that's not the situation in the Eastern Townships. And curiously, one of the questions that we ask ourselves is in the north. We've observed it in the Laurentians, in La Naudière. So the northern part, to the north of Laval, I would say Laval and further, the part that is close to the river, the St. Lawrence River, that part is affected. There's a community transmission, but we also wish to protect the north. On the South Shore, if we look at the situation right now that we have been analyzing, Longueuil, Saint-Lambert, and all those places, there are a few cases, but that transmission is not there. So it's possible that in 2 weeks we'll tell you we're going to separate the eastern townships and it could be a non-active zone, but we're not there yet. So what I want to tell you is that the eastern townships, this is a situation that is very difficult, high rate but no community transmission. I'd like to come back to the masks. Yesterday you spoke of the shortage, and Dr. Arruda mentioned our dependency on international situations. We'd like to understand what happened. Were there things that were expected that were stolen? There are international media that were said that some masks that were made in China that were destined to Europe would have been bought back and sent to the United States, that they were diverted somehow. Are we in that kind of situation? I have the impression that we won that fight, even against some U.S. states. We have a situation when you look at certain states, and I won't name them, but there are states in the United States that are already in shortage of material. We still have some for about a week, and we have confirmed orders that are continuing coming in every day. And we have also done things in Asia, for example, to be ingenious and creative, to pay more easily, to offer transportation of the merchandise ourselves. So I think that up until now, I think that we're doing a lot better than a lot of U.S. states. I don't know who stole orders from whom, but I think that up until now we're doing pretty well. Thank you. I would like to get back to the 519 establishments for the elderly where there's at least one person infected. Do we have any idea of the regional portrait of those establishments? Is it everywhere? Are there some regions more affected than others? And where there are establishments where only one person is infected, could we perhaps relocalize that person, try to regroup them in one specific place to limit the risks of infection with the other tenants? Well, everything can be studied, of course, but if you allow me, yes, there are cases. There are places where there's only one case. Many contacts are being investigated. In other places, there are 5 or 6 cases, and it's difficult for me to tell you here the whole list, but there are. And it is clear, we have to say it, we've always said it. The riskiest stories right now are in the homes where there are older people living, and that's where we will see more cases and unfortunately more deaths. They're everywhere. But now the question is to know, and I think that the Minister for Health said it, within an establishment, there are hot zones and cold zones. Taking somebody to relocalize them somewhere else, especially in a CHSLD, can have important psychological effects because they might not get the same care. What we like, and it depends on every place, so they might dedicate staff to those places. We might, prevent them from leaving, and we also want to avoid people going from one center to another because there's a lot of attendants, a lot of staff that work in 2 or 3 different centers. These are all mechanisms that we are setting up, and every time there is a center that is affected, we have a diagnosis of that person, of that place, and if there was a staff person who went elsewhere, they will stop doing, and there's an entire plan that is also coming up to help out with the participation, and I'll let the Minister add if she wants to add something to that, the participation of the staff to give them the ideal conditions so that if they have any symptoms, they don't come back to work, although they're devoted, So we give them conditions for them to isolate themselves. We continue paying them so they don't have any loss of income, so that they come back to work when they can. So there's a series of actions, and that is being analyzed case by case, place by place. If you're a part of a residence for the elderly and it's not linked with another one, it's not the same owner, you'll manage things in your own place. But if you're the owner of 4 residences in the same city and you share the staff, well, we will talk about all 4. Madam Minister? Yes, we need to make a distinction between the CHSLD, as Dr. Arruda was saying. We have hot zones and cold zones. The hot zones, the hot spots is where we, it is not ideal. We don't like displacing elderly people, but in the present context, it is probably the best thing to do. So we move them to a sector where we dedicate staff with all the protection material. So that is what is being done in CHSLDs. In RPAs, It's different because people have their own apartments, so they are isolated when they are affected by COVID-19. And here there's also dedicated personnel. But it is our biggest challenge right now. It is those residences for the elderly as well as CHSLDs. And we have to right now reorganize the work more. What we need is to minimize the number of people who come to those residences for the elderly, seniors residents, and from the CLSCs, whether it be the same people in the smallest amount of people that come to a residence. I've had a lot of discussions with Madame Blais lately on that today, and that is what we've asked the ministry. So the deputy ministry with the minister with their team is going to reorganize work as much as possible, decrease the number of people that come from our services and even services that we purchase from different organizations so that it be the same people who go in those establishments. So this is, we have to make a significant effort in this end. And we'll see if there's any people, if they want to, if they give services to those residences, if they can, for example, stay in a hotel if they prefer not going back home while they are working. So that is also something that we're working on right now actively in both residences for the elderly and CHSLDs. Second question for Dr. Arruda. I'd like to get back to what you said yesterday about the mask being worn by people in the street to better understand, because yesterday you said you could not recommend the generalized wearing of the mask. There's a lot of experts that are in the media who disagree with you, and there's also data from the CDC in the United States that would tend to show that there's a lot of people who carry the virus who do not have symptoms but could still spread it. So is that a recommendation that is based on scientific data or more in the context of the present shortage? And is it a recommendation that you might review? Listen, I never said that I wouldn't go back on my words. I've always said that what I say today might be different tomorrow. But I went to check and I went to speak with my experts. And even the CDC says that it's not probing data that says that it's adequate. I don't know if you understand, but the level of protection of a homemade mask depends on the quality of the fabric, how it's been adjusted, etc. And what I always say is that it cannot replace hygiene measures. And what I also want to tell you is that they even talk, to protect the healthcare workers and not the population in general, because the people, are going further than what was actually said by the CDC. And even Mr. Trump said, just take just put on a scarf. But a scarf is contaminated. There's all sorts of secretions, and it becomes concentrated. So there's a potential of virus there. And I know that there's a movement of experts and doctors who are bringing the thing. But if you look at science, what science says is that it could be an alternative if there's nothing left for healthcare workers. But what I wish to tell you is that I prefer, with the procedural mask it's not possible, but with N95, I would prefer that we re-sterilize them rather than telling people to use a scarf. I'm very comfortable with my position that I talked about earlier on. If somebody wears a mask in the community because they're scared and they want to wear a scarf, wear a scarf. But of course, if you cough, you're going to accumulate your secretions. Be careful not to touch your face with your hands, and don't touch anything and contaminate things. The procedural mask is not in our culture. We're not used to wearing it. And we see pictures of people, even police officers, who wear the N95 here on their chin. It's very difficult to wear an N95. A procedural mask after a certain amount of time is bothersome. So the CDC did make that recommendation, but read the notes. Go see the text, because I went to read it. It's for healthcare workers. It is healthcare workers. It means healthcare workers. It offers protection that we cannot guarantee. Is it 10, 20, 30%? All I'm telling you is it is an element that probably has, from my point of view, it has more of an effect perceptually speaking. But if it replaces, respiratory etiquette and hand washing? Well, I prefer somebody who coughs in their elbow and who washes their hands rather than somebody who has a mask full of secretions where he's going to touch the mask and then contaminate their fingers and then touch something.
Bonjour à vous trois. Vos réponses, vous me corrigez.
Your answers, and you'll correct me, Madam Minister, if I'm mistaken, but you're saying that contamination has arrived through employees in the seniors' residences and CHSLDs? There are employees that are potentially contagious that have to leave their isolation? Shouldn't we modify the guideline of the guidelines so that people don't fear that the people who are being housed there are contaminated by the staff? And I would like for you to mention, are you asking residents to stay in their rooms and their apartments? What I can tell you, and Dr. Arruda can validate, what is happening in the homes? There's all sorts of transmission. It's not necessarily an employee who transmitted. But the best practice is to minimize and decrease the number of people that are in contact with our elderly. That's the first thing. When somebody is symptomatic, a health worker who presents symptoms, they don't go to work. We do not call to work healthcare workers who have symptoms. What you are perhaps referring to is a guideline that we received 2 weeks ago from the NSPQ, the National Institute for Public Health, because we have a context where we really need to have our staff on the premises. Otherwise, in certain circumstances where we call critical sector, we could have a shortage of services. So what we've done with the advice of the NSPQ, the National Institute, is that there are people who had contacts with symptomatic people, so we isolated them. But after 7 days, we asked them to come back to work with protective measures, a mask, washing their hands. We take their temperature twice a day, so all those protective measures are set up. If the person does not have any symptoms, because the period of 7 days is critical in terms of contacts that we've had. So that is the directive that we have from the INSPQ, and I can tell you that we do it in certain critical sectors because in certain places, amongst others, certain housing centers, we had to put new staff because in that residence, a private one and a few of them, there were contacts. Yes, people isolated themselves, but there was nobody left. So the SUS and the CIUS had to come in and help out and bring new staff to take care of the elderly. So that is at the margin. It hasn't happened often, but what I want to say is that there are critical sectors, for example, in housing, but also in intensive care and in hospital settings where it is possible that at some point we may have to go back to work after 7 days, but with protective measures. Yes, I just want to come back on something that I find really important. The CDC says it's written that when the procedural masks are not available, the healthcare worker may use homemade masks for caring for patients as a last resort. However, those homemade masks are not considered PPEs because we don't know whether they're going to protect healthcare workers. That is what the CDC wrote. So if you do that on top of it, they have to be used with visors that cover the full forehead, that go from the chin and go lower. So you can see that that's what's written here by the CDC. That's the probing data. So, when scientific people tell me, the CDC said something, and then I read this, I ask myself questions on their interpretation of the recommendations. About the regions that are closed, there are parents who have children in shared custody in 2 different regions. Those parents, can they travel from one region to another? That's part of the exceptions that we give. Of course, if the parents are ill or the children have symptoms, we do not recommend it. But we have to respect the court orders. And if the parents want to have a different agreement, of course, it's up to them, but we're going to let non-symptomatic children and parents because we have to respect the court orders. Thank you, Olivier Bossé.
Bonjour d'abord, excusez. L'employeur Métro a commencé
Metro has started distributing statements to prove that you're a worker and then you can move around between a region like Quebec, where in principle there is no roadblocks. Is that coming up in other regions as well? Those kinds of, well, if ever an employee is forced to work and change region, yes, this kind of certificate on the part of the employer might exist, but it exists not only in Quebec. I've been told that that exists in other places as well, where it can happen that police officers require an employer certificate to let people go through from one region to another. But not moving from their home to their place of work, it's not something. Well, if we need going into essential services in a different region, you can do it.
Monsieur le Premier ministre, Madame McCann, Monsieur Arruda, on nous dit, Madame McCann,
we've been told, Ms. McCann, that surgeries at the CHUM in Montreal have been cancelled, including surgeries for cancers, for example. It worries a lot of people, including certain treatments that could also give in intensive care or be given intensive care for people who are in oncology. I'm thinking about immunotherapy treatments, for example. What is the guideline? Are there no surgeries at the CHUM right now? No. There's still surgery being done at the CHUM, but it was probably also, there were some surgeries that were elective. They're not a priority, so they can wait. And I'm using the word urgent, but I also use the word a priority. And what I want to say, particularly in oncology, is that all of those situations are very well examined by a clinical committee. And in oncology, etc., the treatments have to be continued when it's a priority, when there is no impact for the health of the person. However, things can wait. But if there is an impact, the treatments have to continue, and those are the clinical orientations that are taken throughout Quebec and which are being followed by the ministry and by the direction of cancerology of the ministry. So it's clear that those treatments have to be given and that those surgeries be given when they are a priority and when there can be an impact on the health of the person. Mr. Legault, the mayor, Madame Plante, is showing impatience for people who are going to the parks. And I think that with a certain lucidity, Parc La Fontaine, for example, was quite full of people yesterday, where it was, pretty nice outside. Where are you at when you think about the confinement of perhaps certain neighborhoods in Montreal, perhaps even the island of Montreal? Because it was evoked a few days ago, last week as well, that we might get to even a confinement of the island of Montreal. Are you progressing in that evaluation? Well, now there's two subjects. There's the confinement of a region, and there are gatherings in parks. I think that those are two different things. No, we are not looking at confining the island of Montreal right now. Why? Well, because quite honestly, we'd have to do it for what we call the CMM. So that includes, the 450 area code, because there's so much back and forth. And honestly, there isn't such a big difference as all that in the numbers between, 514 and the 450. So there's not a question of closing down just the island of Montreal. However, where I totally agree with Valérie Plante is that it makes no sense to see, for example, yesterday, so many people in La Fontaine Park regrouped together, very close together. It shocks citizens, it angers them, and the message is getting clearer and clearer. For police officers, if it's necessary to start giving fines, we will be giving fines. But please, it makes no sense to be seeing that in the parks in Montreal. I know that Valérie Plante is thinking about closing down certain parks. It's perhaps not a bad idea, but we absolutely have to avoid people gathering in parks. Thank you. English questions now?
In English with Samuel Pouliot à l'arrière from
Good
CDB.
afternoon. You just said it in French. Maybe you could repeat it in English. There's no plan to close the island of Montreal or put control for people who go to Montreal or come from.
There's no plan to close the island of Montreal, because if we decide one day to do that, we would need to close also the suburbs, because north and south of the island of Montreal, there's a lot of traveling. Longueuil, Montreal, or Repentigny, or Terrebonne, Montreal. So it's all together. But today we announced that for the north of Lanaudière and Laurentides, for example, we want to eliminate travels between the north and the south of Laurentides, same thing with Lanaudière. Regarding parks in Montreal, unfortunately, we've seen yesterday, for example, at the La Fontaine Park, many people all sticking together against the law. So first, it's not legal, and second, it's not responsible to do that. So we are telling the police, SPVM in Montreal, to give some infraction tickets if it's needed. And I know that the mayor of Montreal, Valérie Plante, she's thinking about maybe closing some parks. I think it would be a good idea if we keep on seeing groups in those parks.
And Mrs. McCann, there's more and more COVID cases confirmed in seniors' homes right now. How do you reassure families that their loved ones in seniors' homes are safe? And do you have a plan to help them better communicate with their family?
Well, we have put already $133 million in those private residents to help them to put together the measures to protect the seniors, and also to add staff when it's required. What we also want to do is really to organize the work inside the long-term facilities. So, of course, as I said, there are cold zones and hot zones. The hot zones are where people who have the COVID-19 are put together and have a staff that is dedicated and protected to take care of them. In the private residence, we also ask people who have COVID-19 to stay in their apartment. But what we want to do, because we need to make an extra effort, is to organize the work so that less and less, not as much a variety of people go into those residences. That for one residence, there's the same staff going all the time, and they don't go from one residence to another, because, you know, this is home care, from the CLSCs that go inside those residences. So we minimize the numerous contact that those people can have. So we're in the midst of reorganizing in that way. So I want to tell the families that we're doing everything we can. The other thing is that we're going to equip the residents with teleconsultation, with virtual technology. And we want to move as fast as possible so it can provide contact with the families, but also with physicians and with people who can take care of their medical needs. So we're in the midst of doing this. And I know that some seniors have iPads and they communicate with FaceTime, which is a great thing. But for the others, we want to organize those tools also.
We're a little short on time. Katsune, CBC.
Follow up on seniors' homes. There is a labor shortage already in these facilities for seniors. In Ontario, for example, because of the shortage of workers, they are relaxing the hiring conditions, asking volunteers to drop in to help out. And then in Quebec and Gaspé, there are some staff members that were replaced by workers who were not on site or had an interest to work with seniors. So basically, what is the plan there by the government of Quebec to make sure that all seniors institutions are fully staffed in the context of COVID-19?
Well, we have already volunteers that are taking care of the elderly, and we will continue to support them. And we've added $133 million in budget to help those residents to hire more staff if they need, and they probably will need to hire more staff. So that's the budget that we gave them to really go forward and hire more people.
Second question.
According, one of my colleagues told me that all testing sites across Quebec are being shut down for 48 hours to deal with the backlog and in test waiting to be processed. So when is this happening and why is this backlog happening?
First of all, the backlog is related to the expansion, rapid expansion that we put for testing. We did test a lot, but as we did test a lot and we test at different places in Quebec, coming from one site to over 12 or 19 now, I think, that makes a big quantity, and those labs were also under surveillance of the first one to make sure they get good quality. So there was a backlog coming, and we did test and test and test. Actually, it's true that from the last 24 hours, and I'm sorry, we are 1st of April. I don't even know the day, but I'm 1st of April. Yes, and we are on a Wednesday. I'm sorry. Okay, so no, I'm sorry because and then because the weeks are getting around and around, and I don't know. So I'm just telling that because of this backlog, because we want to get good data, not only good data, but making sure that people who are waiting for 3-4 days get their results, we concentrate. We keep the ones who had an appointment, and we concentrate the work to the emergencies and the case that must be made right now because there is an impact on the case control. There is an impact in the nursery room. It is workers. So, but now this backlog is going down, and the activities are going to begin again, perhaps even with new priorities based on the epidemiology, and that will stabilize the situation, and at least we will have tests for the one who needs, with the right time for analyzing and having the answer as soon as possible.
I want to stress this because this is very important that we are prioritizing the patients in the hospitals, but also the people in the residences and the CHSLD, the long-term facilities. So this is very important that we test them as soon as possible, and also the health workers. So this is very helpful for the people, obviously, but also for the health workers and for our system. Because if you don't have to wait for 4 days for a result as a patient, you have to wait much less than that because you're prioritized. You can imagine how it's helpful for the patient, but also for the organization of everything in the hospital and in the long-term facility as well. So this is very good for the system.
Thank you. Again, we're short on time, so real quickly, a question sent by email from Philippe Autier, Montreal Gazette. I know, Mr. Legault, you've said that you have no plan to close Montreal, but still Montreal has the most cases of any city in Canada. People are very concerned about the continuing spread of the virus and are asking for stricter measures. Are you considering implementing stricter rules for Montreal?
Okay. I think when you talk about Montreal, what I was trying to say is that we cannot talk only about the island of Montreal. You have to talk about the suburbs of Montreal also. Will we close the metropolitan area? It's not excluded at this time, but indirectly what we're doing is close all the north regions, make sure that people of Montreal, they don't go up north. And when I say up north, I include north of Laurentides and north of Lanaudière.
Thank you. Grocery stores are not able to keep up with online orders. With stores closing Sunday, people are worried about getting groceries. Are there more steps to be taken to make sure people can get food? Will police be posted at stores?
Okay. First, we permitted groceries to deliver and take delivery on Sunday. So stores are closed, but they can deliver food to the people, even if they come with their car, people. But of course, the groceries are now hiring some additional staff to deliver food. We're asking some community organism to help for the delivery of food, but I can understand that now many people are asking for delivery, and groceries they cannot keep on.
Okay, thank you. Last questions from Raquel Fletcher, Global News. Local homeless shelters in Montreal say they are not receiving enough financial support from the province to properly support the most vulnerable. This has caused them to cut services. Is more funding on the way, and when can they expect it?
We already injected more money, and I know that the City of Montreal did so also. So I think that right now, Valérie Plante, she's got a very good plan, and she's putting this plan in place for those shelters, and I think it's under control.
And a very last question from Raquel for Dr. Arruda. The employees union at the McGill University Health Center has written an open letter to you asking that each worker be tested once a week to reduce the risk of infected employees infecting patients. Will you do this?
We will look at with our scientific teams to look at it, and if it's recommended, and if we get the availability to do the tests, I think that will be the answer. It will be yes, but we need to make this evaluation and put that into a global strategy about healthcare workers actually.
That's it. That's all the time we have. Merci tout le monde. Merci pour votre patience, votre disponibilité.
Thank you, everyone.